Now look at question 1. You hear a GP called Mihiraa talking to a duty doctor. Now read the question.
Dr. Hudson, I'm concerned about Mr. Larry's condition. He's been admitted with acute chest pain and shortness of breath.
Thank you for the update, Dr. Mihiraa. Can you provide more details about his medical history?
He has a history of hypertension and hyperlipidemia. He's also a smoker.
Does he have any family history of heart disease?
Yes, his father passed away from a heart attack at a young age.
We need to consider the possibility of a heart attack or angina. Let's order an electrocardiogram and cardiac enzymes to assess his cardiac status.
I've already ordered those tests. We'll also need to monitor his vital signs closely and administer oxygen therapy.
Good, Dr. Mihiraa. We should also consider administering aspirin to prevent blood clot formation.
I'll discuss the treatment plan with Mr. Larry and his family. It's important to keep them informed about his condition and the steps we're taking.
Now look at question 2. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Larry, I'm going to change your 4-fluid bag now. This is a routine procedure to ensure you receive continuous medication and fluids.
Okay, Mihiraa. Does it hurt?
The procedure itself is usually painless. You might feel a slight pinch when I insert the new needle.
Will it take long?
The process should be quick. I'll adjust the flow rate to ensure you receive the correct amount of fluids.
Mihiraa, what if I feel any discomfort after the 4 change?
If you experience any pain, redness, or swelling at the 4 site, please let me know immediately. We can adjust the 4 or apply a warm compress to alleviate any discomfort.
Okay, Mihiraa, thank you.
Now look at question 3. You hear a doctor called Mihiraa talking to a neurologist. Now read the question.
Dr. Hudson, I'm referring Mr. Larry to your neurology clinic for further evaluation. He's been experiencing persistent headaches and cognitive decline.
Thank you for the referral, Dr. Mihiraa. I'll schedule an appointment for Mr. Larry. Could you provide me with more details about his symptoms?
He's been complaining of headaches that are often accompanied by nausea and vomiting. He's also having difficulty concentrating and remembering things.
Has he noticed any changes in his vision or speech?
Not that he's reported, but we should rule out any neurological disorders that might be causing his symptoms.
I'll perform a thorough neurological examination, including cognitive tests and imaging studies. Dr. Mihiraa, we may also need to consult with other specialists, such as a neuropsychologist or neuro-ophthalmologist, depending on the findings.
Thank you. I appreciate your expertise in diagnosing and managing complex neurological conditions. I look forward to discussing Mr. Larry's case with you further.
Now look at question 4. You hear a doctor called Mihiraa talking to a hospital manager. Now read the question.
Mr. Hudson, I'm writing to express my concern about the state of our current medical equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Dr. Mihiraa. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inaccurate diagnoses, delayed treatments, and increased patient risk. It's essential to invest in modern technology to provide optimal patient care.
I agree, Dr. Mihiraa. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should also prioritize the most critical equipment needs, such as those used in emergency situations or for complex procedures.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient safety and ensure that we have the necessary resources to provide quality care.
Now look at question 5. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Hudson, I'm concerned about the recent changes in our duty hours. The increased workload is affecting our ability to provide quality patient care.
I understand your concern, Mihiraa. The new schedule was implemented to optimize staffing and improve efficiency. However, I recognize that it may be challenging for some staff members.
The longer shifts and irregular hours are taking a toll on our physical and mental well-being. We're struggling to balance our work and personal lives.
I agree that the new schedule can be demanding. We need to find a balance between meeting the needs of our patients and ensuring the well-being of our staff.
Perhaps we could consider alternative scheduling options, such as compressed work weeks or flexible shifts. This could help reduce burnout and improve job satisfaction.
That's a good suggestion, Mihiraa. We'll explore different options and seek input from the staff to find a solution that works for everyone.
Now look at question 6. You hear a head nurse called Mihiraa talking to a junior nurse. Now read the question.
Nurse Hudson, I've noticed some inconsistencies in your documentation. It's crucial to maintain accurate and detailed records.
I apologize. I'll be more careful in the future.
It's not just about avoiding errors. Accurate documentation is essential for patient safety and legal compliance. It helps us track progress, identify trends, and make informed decisions about patient care.
I understand, Mihiraa. How can I improve my documentation skills?
Pay attention to detail and use clear and concise language. Avoid using abbreviations and jargon that may be misinterpreted. Document promptly after each patient interaction to ensure accuracy.
Document subjective information objectively. Instead of writing, "patient is in pain," describe the intensity of the pain using a pain scale. This will help us track changes over time and make informed decisions about pain management.
Now look at question 7. You hear a head nurse called Mihiraa talking to the team. Now read the question.
Team, I want to discuss a recent incident involving Mr. Rio. Unfortunately, he had a fall from his bed last night. This is a serious matter that requires immediate attention.
What caused the fall, Mihiraa?
We're still investigating the exact cause, but it's possible that he might have tried to get out of bed unassisted.
Should we consider using bed rails to prevent future incidents?
Bed rails can be effective in preventing falls, but they also have potential risks. We need to weigh the benefits and drawbacks carefully. Perhaps we can implement a bed alarm system to alert staff if Mr. Rio tries to get out of bed.
What about patient education? Can we educate Mr. Rio and his family about fall prevention strategies?
That's a great suggestion. We can provide them with information on how to use call bells, the importance of staying in bed, and the risks of falls.
Mihiraa, we should also review our staffing levels and ensure that we have adequate staff to monitor patients closely.
Absolutely. By addressing these issues, we can reduce the risk of future falls and improve patient safety.
Now look at question 8. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Rio, I know being in the hospital can be lonely and isolating. It's important to maintain your social connections and find ways to stay connected with loved ones.
Mihiraa, I miss my family and friends. I feel so alone here.
I understand how you feel. Social isolation can have a negative impact on your mental and emotional well-being. Let's see what we can do to help.
I don't have a smartphone, so I can't video call my family.
We can help you connect with your family through video calls. We can also arrange for your family members to visit you, if possible.
That would be great, Mihiraa. I'd really appreciate it.
In the meantime, we can encourage you to engage in social activities within the hospital, such as board games or group activities. We can also provide you with reading materials or other forms of entertainment.
Thank you for your help.
Now look at question 9. You hear a doctor called Mihiraa talking to a head nurse. Now read the question.
Nurse Hilton, I'm concerned about Mr. Rio's condition. His blood pressure is elevated, and he's experiencing chest pain.
Yes, Dr. Mihiraa, I've noticed those changes as well. He seems to be in discomfort.
We need to adjust his medication regimen to manage his blood pressure effectively. Let's increase the dosage of his antihypertensive medication and add a beta blocker to help control his heart rate.
Should we consider any additional medications, such as a diuretic?
That's a good idea. A diuretic can help reduce fluid retention and lower blood pressure. We'll monitor his kidney function closely to avoid any adverse effects.
How often should we monitor his vital signs, Dr. Mihiraa?
We should monitor his blood pressure and heart rate every hour. We'll also need to assess his urine output and electrolyte levels.
I'll inform the nursing staff about the changes in Mr. Rio's medication regimen and monitoring plan.
Now look at question 10. You hear a physiotherapist called Mihiraa talking to a hospital manager. Now read the question.
Mr. Hilton, I'm writing to express my concern about the limitations of our current rehabilitation equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Mihiraa. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inefficient therapy sessions and hinder patient recovery. Investing in modern equipment can significantly improve patient outcomes.
I agree, Mihiraa. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should prioritize the most critical equipment needs, such as those used for balance training and gait rehabilitation.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient care and ensure that we have the necessary resources to provide effective rehabilitation services.
Now look at question 11. You hear a nurse called Mihiraa talking to the team. Now read the question.
Good morning, team. I want to discuss a recent change in hospital policy regarding patient visitation hours. Starting next week, visiting hours will be extended to accommodate more family members and friends.
That's great news, Mihiraa. This will definitely improve patient morale.
Absolutely. We want to create a more welcoming and supportive environment for our patients. However, it's important to maintain a quiet and calm atmosphere in the wards.
How can we ensure that the extended visiting hours don't disrupt patient care?
We'll need to implement strict guidelines for visitors. They should avoid making noise, avoid bringing in outside food, and respect the privacy of other patients. We'll also need to educate visitors about infection control measures, such as hand hygiene.
Mihiraa, will there be any additional staffing requirements to accommodate the increased number of visitors?
We'll assess our staffing needs and adjust our schedules accordingly. We may need to hire additional staff or reassign existing staff to manage the increased workload.
Now look at question 12. You hear a cardiologist called Mihiraa talking to the team. Now read the question.
Team, we have a complex cardiac surgery scheduled for Mr. Rio today. Let's review the patient's medical history and discuss the surgical plan.
Mr. Rio has a history of hypertension and diabetes. Dr. Mihiraa, he's also on several medications, including blood thinners.
We need to carefully manage his medications preoperatively to minimize bleeding risks. Let's consult with his primary care physician to optimize his medication regimen.
What about his allergies? Is he allergic to any medications or latex?
We'll need to double-check his allergy history and ensure that we use latex-free equipment. We should also have emergency medications on hand to manage any adverse reactions.
Should we consider any specific preoperative tests, such as an echocardiogram or stress test?
It would be prudent to review his recent cardiac tests to assess his current cardiac function. We may need to adjust our surgical plan based on the latest findings.
What about post-operative care, Dr. Mihiraa? What kind of monitoring will be required?
We'll need to monitor his vital signs closely and assess for any signs of complications, such as bleeding or infection. We'll also need to manage his pain effectively and provide appropriate rehabilitation.
Now look at question 13. You hear a triage nurse called Mihiraa talking to the patient's carer. Now read the question.
Mr. Tim, I'm concerned about Mr. Franklin's condition. He's been experiencing shortness of breath and chest pain.
That's concerning. Have you assessed his vital signs, Mihiraa?
Yes, his blood pressure is elevated and his heart rate is rapid. We've administered oxygen and pain medication to alleviate his symptoms.
We should consider transferring him to the emergency department for further evaluation. A cardiac event is a possibility, given his symptoms and medical history.
I agree. We'll prepare him for transfer and notify the emergency department about his condition. We should also contact his cardiologist to inform them of the situation.
Good, Mihiraa. Remember to document all interventions and vital signs. We'll need this information for the emergency department and his ongoing care.
Now look at question 14. You hear a GP called Mihiraa talking to a pharmacist. Now read the question.
Pharmacist Tim, I'm concerned about Mr. Franklin's medication regimen. He's experiencing some side effects from his current medications, including nausea and dizziness.
That's concerning Dr. Mihiraa. Let's review his medication list and identify any potential interactions or adverse effects.
I've checked for interactions, but I can't find anything significant. Perhaps it's an idiosyncratic reaction to one of the medications.
We could try adjusting the dosage or switching to an alternative medication. However, we need to consider the potential impact on his overall health.
That's a good point. We should discuss the risks and benefits of each option with Mr. Franklin. We might also need to consult with a specialist for further advice.
I agree, Dr. Mihiraa. It's important to involve Mr. Franklin in the decision-making process and ensure he understands the potential risks and benefits of each option.
Thank you for your input, Tim. We'll work together to find the best solution for Mr. Franklin.
Now look at question 15. You hear a physiotherapist called Mihiraa talking to an assistant. Now read the question.
Assistant, please prepare the patient for the hydrotherapy session. Ensure the pool temperature is maintained at the optimal level and the necessary equipment is ready.
Certainly, Mihiraa. Should I assist the patient into the pool or would you prefer to do it yourself?
I'll assist the patient. Please ensure the pool area is clean and free of any potential hazards. Double-check the water quality and pH levels.
Yes, of course. Should I prepare the exercise plan for the session?
That would be helpful. Please review the patient's medical history and tailor the exercises accordingly. We need to focus on improving their range of motion and strength.
Any specific exercises you'd like me to emphasize, Mihiraa?
Prioritize exercises that target the affected areas, such as the knee and ankle. We can incorporate balance exercises to enhance stability and prevent falls.
I'll prepare the necessary equipment and assist you during the session.